Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
No, just we can start. Hello to just I'll say hello to everyone and we'll start the questionnaire.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Oh, what happens? So we have many electrical discharges in our brain. For everything we do, like for we see, we hear, we do anything, we have like electrical discharges in our brain. Whenever any neuron or nerve cell or brain cell, I would say, is abnormal, it discharges a lot. There is abnormal signal, excessive signal. So this causes basically seizures, and depending on whether where these signals are starting from, the symptoms happens in a seizure. Sometimes it varies where the focus is, we say. There can be motor manifestation, jerky movement. Sometimes the patient just becomes unaware of the surroundings. Can be sensory manifestations. So there is like these abnormal excessive discharges are just like there is a storm in the brain. So this is what, in brief, a seizure is.
What is epilepsy?
Yeah, very good question. I would say there is a lot difference between a seizure and an epilepsy, which common people do not understand. They use both the terms interchangeably. So seizure is just a single event, and when we have like recurrent seizures, more than two attacks, then we call it epilepsy. That attacks should be unprovoked. What I mean to say by unprovoked, that seizure can be triggered by maybe high fever or some metabolic derangements, severe sepsis. But seizure should be unprovoked in case of epilepsy and should be more than two in number. So on a regular basis, if seizures occurs, we call it epilepsy.
What are the different types of seizures and do they affect people differently?
Yeah, sure. Yeah, definitely. Type of seizures, I would say broadly, it is of two types. One is focal and one is generalized, depending on whether these, as I already told you about these abnormal excessive electrical discharges. So, whether these abnormal excessive electrical discharges are coming from a single point in the brain or the whole brain is discharging abnormally. So, depending on that, we classify it into a focal seizure or a generalized seizure. So, this is what happens inside the brain. But what happens outside, based on that, there is also a classification. Like there may be a jerky movement which involves only a body part, like maybe just one hand or just facial twitching or just eyelid blinking. So depending on that, it may be like focal seizure or the whole body is jerking. It can be generalized. Apart from these motor manifestations, there can be some abnormal sensations. There can be some abnormal sounds in the ear. Patient can see abnormal flashing lights. So these can also occur. So there are many type of seizures, and there is an international body to classify seizures. And one thing I would add that
Got it.
very important to classify
Yeah,
seizure for us, especially the treating doctors, because based on that, the classification of epilepsy helps us to choose the medication, which medication has to be given in which type of seizure, so to work it better. So this is very important for our perspective, in fact.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Maybe around 50-60% of epilepsy has has an underlying cause which we can see. That may be in brain, we may have any infection like tuberculoma or neurocystic sarcosis. There may be some structural malformation which can cause seizure. There can be any SOL, like any tumor in the brain which can cause seizure. Some trauma or stroke may trigger seizure. But in around 40 to 50% of cases, there is not like exact cause is identified, but it is said that there is some genetic basis underlying these seizures. So, genetic earlier they were called idiopathic seizures, but now they are called genetic seizures because they had an underlying genetic cause. Whenever a patient carries abnormal mutation, that predisposes the patients to have a seizure.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Uh, yeah, I already mentioned you some. There can be varied signs and symptoms of seizures. What a common people know is abnormal jerky movement with like a patient becomes unconscious. But apart from that, there are various manifestations of seizure which common people are not aware of. Like one
Yeah.
epilepsy in a child called absent seizures. In that, the child becomes just unaware, staring low, and he will not interact just for moments, like for seconds, and then the child will return. So there is unawareness from the environment or the surrounding, nothing else, no motor jerky movement like that. There can be some abnormal twitching, as I already mentioned you. There can be some abnormal sensation, abnormal hearing in the
Yeah.
abnormal sounds in the ear. So based on that, there are other like these autonomic seizures. We say there will be piloerection, goosebumps, like there will be abnormal sweating. So these can also occur. So there are various symptoms that should be people should know that this can also occur.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, this is the most unfortunate thing, which is tagged with epilepsy, and it is like stigma is from the very beginning. Like for many years, it's been associated with this epilepsy, and it is like I would say very unfortunate due to this stigma. There is. The people with epilepsy are not accepted normally in the society. They face problem in getting a job. Any job giver do not wants any patient who has seizure to give job. In marriage there is a great obstacle. No one no one like wants to marry any person who is suffering from epilepsy. In schools they face problem. If the administration knows that the child has seizures, they do not want to take those sort of children. So these are very
Yeah.
bad things associated with epilepsy. Yeah.
How does this stigma affect people with epilepsy?
Yeah. These are like very much interconnected. Patient who have epilepsy, the stigma associated with that causes like stress and like depression. Patient do not accepted normally in the society, so they have stress. They have low mood, and this stress and low mood triggers seizure. So there is a vicious cycle. People with epilepsy have stress. Stress causes more of seizures, so that cycle continues. So we as a community should break this stigma. Now there are many awareness programs that we're running in our country. The whole November month is celebrated as the Epilepsy Awareness Week. So maybe these are all helping, and in future, maybe we can overcome with this stigma associated with the disease.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah. A nice question. I would say the most common trigger which we face is missing the dose of the anti-epileptic drug. And most commonly, patient with recurrent seizure comes and they say that they have missed the dose. So one and the most common is the missing the dose of anti-epileptic drugs. Next, I would say it varies depending on which seizure type. Some seizures precipitate when there is lack of sleep. Some seizures like flashing light, may cause seizure triggering. Sometimes it is called catamenial epilepsy, in which the menstrual cycle affects the seizure. In some time during the menstrual cycle, there is tendency to have seizures. So apart from that, the stress, dietary factors, these also trigger seizure in some of the cases.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yes, I would say I already discussed a few points like epilepsies which are triggered by lack of sleep. They should be told that they have to maintain their sleep, like full no, like they have to go on bed on time and like wake up at particular time. Lack of sleep will trigger in those. We have to manage this level should be low. Sometimes this more of physical stress causes triggers these seizures. So not like much of physical stress should an epilepsy patient should take. Other than that,
Oh,
maybe a good balanced diet, other behavioral change.
thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, I would say any patients, if encounters any person, if encounters any patient having seizures, first and foremost is do not panic. And then, if there are any sharp objects around, you can remove that. Then make the patient lie down on any side. The science behind that is that there is frothing and lot of discharges from the mouth coming, so that should not go inside our trachea or air like passage. So when
Yeah.
we the patient lie down on the side, these all fall down, do not go inside this trachea. Next is
Yeah.
then after stabilizing the patient, then we have to seek for the nearby medical help. And if there are any tight clothing around the like tight collar or any tight belt, that should be loosened. And sometimes there is a tendency to like put a spoon and like put the shoe in in front of the nose. So these should not be done. These are not helpful at all.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Finally, I would say that any patient suffering from epilepsy can do equally good in their like personal life as well as their professional life. There should
Yeah.
not be any like boundaries that these they cannot do. And most of the epilepsy, around 70%, are curable just with maybe just one or two medicines. The thing is, they have to take it regularly on like particular time. They do not have to miss the dose. So I would say these things.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.